Hello. Okay. I am going to just make a quick video just to talk about some cannulation techniques for the home dialysis patient. And okay, let's get started. So this right here is what I'm going to use to be my pretend blood vessel. It is about the same circumference as the grafts that the physicians use to create, and it is the same size as a small fistula after it's created. This right here is the needle that I'm going to use. This video is for both nurses and patients, so I'm going to go into just a little bit more depth. Obviously, the needle is under my cover here. These are the wings, and then we have the tubing. There's always a clamp on the tubing, and then a cap at the end of the tubing. So what I want to first talk about is the needle itself. There is a scoop. It's like a little ice cream scoop. You see that? We typically always stick vessels scoop facing up. You can do scoop down. That is typically reserved for grafts. It's very common to do scoop down when you have a graft. And I've used it more frequently with fistulas that are smaller and closer to the surface with very little tissue, fat, or skin in between the vessel itself and the outside. So I'm going to show you some scoop up technique first. I do prefer, when cannulating, to go at a 45-degree angle. This is pretty much what my 45-degree angle looks like. Let me move so you guys can see a little bit better. All right, so 45-degree angle, and then you line it up. You find the juicy center of that vessel, okay? You want to feel ahead of time, where is that vessel going? Is it pointing towards the right or the left? Does it have any curves in it? We want to know the direction and visualize it underneath the skin so that we can point the needle in the direction that it's going. It's like putting your car in a lane. We want to make sure we find that juicy center. We're going to find the juicy center and we're going to stick the juicy center. And you see how I just lined the needle up with the direction of it? I don't want to, look, if I'm doing that, what's going to happen? It's going to go outside the side wall of the vessel. I want to keep it in the lane. I want to keep it running along the direction that the vessel is going in, okay? So find your 45 degrees and then just push straight down at that 45 degrees, okay, until pop, you feel yourself get in there. The other thing that's going to happen is you're going to have, in this little window right here, you're going to see blood. You're going to see blood just, blood is going to be a pulsing, like a little heartbeat inside there, okay? And so once you're in, that's your sign. You will feel it and you will be able to see it. And that's another reason why I hold back here behind the wings so that I can see that pulsing, okay? So once I'm in and I've got my pulsing, that's when I can change my angle. I don't need 45 degrees anymore because I don't need to go below the vessel. I want to stay in the lane, right? So now I'm going to lower it to the level of the skin, and I'm going to advance that needle inside the vessel nice and straight, okay? So it's straight down at the angle that you prefer. I know a lot of people prefer a 20-degree. I don't like this 20 degrees because you're actually spending more time tunneling through the skin before you get into the vessel. And so you're way back here before you even hit blood, and so you have very little of needle that ends up in the vessel itself. I like to go ahead and go straight down at a 45-degree angle, not a 90-degree angle, guys. I'm not going straight down, but I'm gonna push in at that 45 degrees. Once I've got my flashing and I know my needle is inside the vessel, that's when I'm gonna lower it and advance it along that line there. Then you've got the bevel down cannulation. And again, I like to hold back behind the wings so that I can see that flashing. You see a lot of people grip the wings like this, okay? The most important thing is that you grip it so that you have control of the needle, the direction that it's pointing in, and that you can have a good grip on it and push that needle in where you want it to go. Okay, so we're gonna do some bevel down now so you can see that. And guys, I know I shake, I'm nervous. It's a video, give me a break. Okay, so we're just gonna push in, same thing, 45-degree angle, lower it once I'm in, advance it, leave the car in the lane. I also don't wanna push this in too far. I don't know if you can tell, wish I had like a little laser pointer, but where the shaft of the needle meets the plastic there, it's like a little V. And you can keep pushing that in when it's somebody's arm, and it will expand the hole that you're putting the needle in. And we don't want to do that because then they're going to have prolonged bleeding after treatment. So make sure once you're in all the way, you stop. Don't keep shoving that needle in any further. It doesn't need to go. Okay, the next thing I want to show you is how to tape this up the way we like to tape for home dialysis patients. I'm going to see if we can see over here. So I'm going to put that needle in as we discussed, right? And that needle is hopefully, for the purposes of this video, going to hold still for me. I'm going to make sure you guys can see it. I might need to move my arm. Okay. All right, so once we put the needle in, you need to be ready because that needle can push out, it can fall out, and you need to hold very, very still and have everything that you need to go ready to go. The first thing that I use is a shorty. And yes, it's a piece of tape that is short. And the first thing that I'm gonna do is I'm gonna tape down one of my wings. Okay, so I'm gonna put it on the wing right in the center. Okay, once I push the center of the wing down to the skin, then I'm gonna make sure it adheres to my skin there. Now, notice there's a flap, okay? That's important because it makes it easier for the patient to hold on to it so they don't get all the adhesive and stickiness off, but also it's easier to take it off at the end of treatment. This flap must be on the bottom, okay? You don't want to put the flap up here. The reason being, when I go to pull this tape off, I want to be pulling up instead of down. If I am pulling this tape down, guess what could pull right on out and blood shoot across the room, okay? We don't want to be pulling down on these needles. We need to make sure that our tape is being taken off in a safe direction. Okay, so that's the first thing, is they need to get one piece down. That's gonna hold the needle in place for us, okay? We're not scared of it slipping out at this point. They can take their time with the next piece. So I'm gonna get another shorty. This is really no more than 1.5 inches long. Again, I'm just gonna grab onto the center of my tape to pull the wing down, and I'm going to make sure there is adhesive on the bottom, below the wing, and above the wing, okay? Now, if I had put this on poorly, it would look like this. Okay, lots of adhesive above the wing, but this flap that I created is not holding the wing to my skin. There is no adhesive on the lower part there. So make sure we're getting that at the center, okay? And we're holding each wing down with adhesive directly on the skin, above the wing and below the wing. The H taping next will hold we'll strap these guys down, and I usually like to strap them down below the wings, and then I strap them down above. So this would not be there. This would be under the skin. You wouldn't see any of this, and unfortunately I can't put this needle in me. So the H taping is one more piece. Now, if you have a patient that has trouble getting up under this, you don't have to get up under it. You can go right across. Right across the wings. This is H taping because you're forming an H, right? Make sure there has got to be adhesive on this side of this wing tape, we're going to push it all down, okay? Make sure it adheres to the tape, make sure it adheres to the wing, make sure it adheres to the skin, okay? You don't put it on loosely and walk away. That tape will just come right off. We want to actually make it adhere to the skin and the tape and the wing and everything that it's touching. But you need to have adhesive on the skin to this side of that wing tape, and you need it on the skin to that side of this wing tape. If I had just laid this right across here like that, and this gets picked up, this isn't going to hold it down, is it? Because it's just on top of this tape. It needs to be on the skin. Okay, so make sure that your H tape is long enough to have adhesive over here and over here to keep that needle from going anywhere when we don't want it to. Okay, I do use a second one. Like I said, I like to strap down my wings on both sides of the, so I have what looks more like tic-tac-toe when I'm done. So of course this needle is under the skin. You wouldn't be seeing any of this, but what I'm doing is I'm taping down this wing so that this piece that's holding the wing in the, I'm now strapping that to my skin, and I've got adhesive on either side. This won't go anywhere. It hasn't even moved a milliliter, even though I tried to make it move. It is very strong taping. It's really easy to do one-handed, and then also we can take it off one-handed. So you're just going to take everything off in the reverse motion. Now, when you pull tape off, use a pinky or a middle finger or whatever you want to use to keep the line from moving as you're pulling stuff off of it, okay? So you're just kind of splinting it and holding it still. Again, I'm gonna hold my line when I get to it so that when I pick this up, I'm not moving that needle and having it fishtail inside my vessel, causing little nicks and injuries. I'm gonna go to pick this up, but I'm gonna put my finger down. Doesn't matter which finger you use as long as you're stabilizing that needle so that we can pull this tape all the way off without having to worry about a problem. Again, we're going to be needing to pull up. I'm going to put my finger down so it doesn't go anywhere, and I can adjust as I move. Okay. Once you get that last piece of tape off, you are going to take the needle and you're going to slide it out just a little bit. Okay, we do not take it all the way out. I am just sliding it out a little bit, and your nurse will show you how much is a safe amount. But then you're going to grab your bullet, your pre-made bullet and piece of tape, and you're going to put that over nice and firmly where it's coming out of the skin. The center of this gauze pad underneath here should be right at where the needle leaves the skin. Okay, and I've already pulled it down a little bit of ways. And the reason we do want to pull it down a little ways is because when I go to pull it, I don't want my wings getting caught under this. Okay, so your patient is now going to take the end of this in this hand, and now they have their free hand to put over here. We do not push down until the needle is out. So you are going to pull, push. Soon as that needle comes out, this immediately needs to start pushing. This will have a little bit of blood that will drag out with the needle. That is not a problem. That is totally normal. But you don't want to be pushing down until the needle comes out, because that needle can slice the vessel, the skin, the tissue as it is being pulled out if you are pushing on it at the same time. So, and especially if you have buttonholes, you don't want to be slicing that buttonhole formation. Okay, we're going to create a nice little track. We don't want to be slicing and dicing it up. So this is wonderful because after I have been holding for 10 minutes, it is now perfectly taped down. I can move on to get my next needle out. And then later I'm going to come back with tape to finish it. And what I mean by finishes it is we always have one across the center, and then we have another piece of tape that is the center top half and another piece that is center low half. So what you want to do is put it on there, and then you're just going to kind of stretch it in this direction, and then you're going to, I can't see it because my hand's in the way, you stretch it in that direction. Okay, so, and then there, that was the bottom half. So let's do the top half for the video. I'll try to get this a little bit closer. So I'm going to stick the center of this right on top here. And then I'm going to stretch it this way. And then I'm going to try to do this so that my arm doesn't block it. But I'm going to stretch this one so that we are really pulling that bullet down in to hold pressure over where those needles were sitting for so long. All right, I think that's all I had to cover today. Thank you so much.